I'm sorry not to be there in person with you today. I was so looking forward to emerging from these last difficult years of isolation and physically moving forward with all of you. The irony that it should be COVID that has thrown a wrench in these best laid plans is not lost on me. When I accepted the offer to host this wonderful event, it was not only because the honor of being on the dais with the incredible giants you're about to hear from. It was also because I wanted to thank the network for the unique and critical role it has played in making self-managed abortion a possibility in the United States. The National Women's Health Network has been critical to the existence and success of Plan C and others who, thanks to almost a decade of hard work, have good news to share. Abortion pills are available with a prescription and by mail in all 50 states, despite the abortion bans that are increasingly endangering our health and human rights. In 2014, before Plan C even had a name, it was the network that co-hosted the first meeting to be held in the United States to share with reproductive justice leaders from across the states the international evidence that abortion pills were safe and could be self-managed. Out of that meeting came the seminal article co-authored with Amy Allena and published in Women's Health Issues, the title of which still resonates today: Bold Action to Meet Women's Needs, Putting Abortion Pills in U.S. Women's Hands. And then 2 years later, when we at Plan C needed a new home, it was the network that stepped up and agreed to take us in. This was no small matter. It was November of 2016, and with the election of a new president, organizations across the country, especially those receiving federal funds, responded by self-censoring their work, especially abortion work. Our fiscal sponsor no longer felt they could support Plan C. This, despite the fact that we were a public education campaign designed to share scientific evidence and protected by the First Amendment of free speech. Were it not for the network's brave leadership during this time of pervasive fear, Plan C would likely have ended then and there. The willingness to work with and support groups working on self-managed abortion, a very stigmatized and frankly politically risky issue, has helped others as well. By supporting nascent and intrepid groups like the Miscarriage and Abortion Hotline and Plan C, the network has been very directly helping folks all over the country manage their health and access the care that is their right. There is still so much to do. While abortion pills are safe, effective, affordable, and can be self-managed, access to them is still far from easy or equitable. Abortion bans now exist in 20 states, and other states may soon follow suit, purposely making obtaining abortion pills very difficult and literally putting people who do so at risk of criminal charges. As usual, these laws disproportionately affect people who are already at greater risk of criminalization because of their race, gender identity, economic status, and other factors. I believe all of us here today agree that no one should be criminalized for self-managing their own abortion or helping someone else do so. More than ever, we need to focus on the network's vision: quality, comprehensive, and equitable healthcare that empowers and supports us in our lives. Thank you for supporting this important organization that has and will continue to make a real difference in women's lives and the lives of those they love.